The Marble Light is brought to you by Peninsula Home Care.
Well, a cancer diagnosis can be devastating, and for many cancer patients, the idea of making frequent treks to the hospital for chemotherapy treatment is daunting. Now, Peninsula Home Care chemotherapy nurses can administer chemo treatments in the comfort of the patient's home. And joining us to talk about this first for the Lower Shore is Therese Ganser, Peninsula Home Care Branch Director, and Jennifer Klein, Peninsula Home Care Chemo Certified RN. Thank you so much for joining us this afternoon. First of all, what is the process for receiving chemo in your home?
Once the oncologist deems that it's appropriate, the first thing that will happen is that the patient will receive what's called a portacath. So there's a little line that would go underneath the chest wall. It's usually on the left or the right. At that given point in time, we would have you ready. You'd already have the blood work already drawn. There's a we have to watch for infection, so we want to make sure that there isn't any infection. And at that given point in time, we'd get you started up and put the line in and work from there.
All right. And how long do the treatments generally last?
They last about 46 hours. Okay. Typically, the patient comes in, and I have my Vanna here. She's going to kind of show us. This would be the line that would be inserted, and this is how simple it is. The idea is that you have to have a penny, because this is the actual chemotherapy. This is the cat that would keep the fluid dripping throughout the whole process for that 46 hours. So they have to use it to turn this in to get there, and then we call it your lucky penny. Now so that you then have that process.
So the process itself of receiving the chemotherapy lasts 46 hours?
Yes.
Oh, okay.
Yes, in your own home.
In your own home.
So you're much more comfortable.
Yeah. Now, can any nurse administer the chemo in your home?
We do not do that. We make sure that we have certification for oncology nurses to be able to do that. We want to make sure that we are providing the best outcomes, and so we want to make sure that they know more about oncology as well as chemotherapy.
Right, right. Now, obviously, chemotherapy is something that's usually done in a clinical setting, in a hospital or a doctor's office. You're doing it in the home, so I imagine there are some safety measures when handling all of the chemo and everything. What are they?
Well, there are your gloves, and typically the nurses are the ones that will be using those when they're using the chemo agents. This is called a spill kit. So if in fact this becomes undone, we're available 24 hours a day, 7 days a week, so we want to make sure that you know, but we have this already in the home so that if there is an issue that we'll be able to work from there. And then we have the disposable that once it's done, that you make sure that it is a hazard safety from that process. We want to make sure you wash your hands a lot. We want to make sure that you flush your commode a lot, because that's chemicals that are going through that process. And we want to make sure that
other people in the home
are staying away from the chemotherapy. They don't have to stay away from you, but they want to stay away from the chemotherapy, aerogens, the hazardous waste, things of that nature.
Yeah, because it really is toxic, isn't it?
Yes,
the chemotherapy, the medicine, or what it's used.
Yes,
Right.
And I think the most important thing too is that your resistance is down. So for a chance of infection, you really don't want anybody that's had the cold and flu by you at that time. But other than that, you go on with your daily in your own comfort of your own home.
Right.
And we're always available 24 hours a day, 7 days a week.
Right. Now, you had said that if the oncologist deems that you are able to get the chemotherapy in your home, why would you not be? I mean, what are the restrictions?
At this point, there is only one chemotherapy agent that we're allowed to use in the home, and that's primarily used for colon cancer and breast cancer. And so we want to make sure that we are abiding by the guidelines and doing what's best for you in that process. As things continue, we hope that we'll be able to provide more.
And Jennifer, you obviously administer the chemotherapy in homes. It's very easy process, and do you see a difference in the patients?
Yes, they actually recover better within the home setting, so they do very well. And because it's expanded over a 46-hour period, the symptoms, the side effects are less. that are reduced.
Right.
So.
Something to think about. And of course, if you'd like some more information on Peninsula Home Care, including more details on chemotherapy in the home, go to delmarvalife.com and click on the show tab. Thank you, ladies, for joining us this afternoon. Very important information.
Still to come on Delmarva Life, with temperatures in the 90s for the rest of the work week, your air conditioner is going to be cranking. But what do you do if it breaks while you're at work? We're going to introduce you to a Delmarva businessman who says it's not your fault, so why should you pay the extra cost? Come on, really? Did somebody say that? Okay, well, we're going to explain it all, and it's coming up next.